Good morning, everyone. I am Dr. Payal Khatua, and I am going to present OCT biomarker changes in diabetic retinopathy patients after treatment with intravitreal ranibizumab. Diabetic macular edema is the main cause of vision loss in patients with diabetic retinopathy, and it can be divided into three categories: sponge-like retinal swelling, cystoid macular edema, serous retinal detachment. OCT biomarkers helps to identify ultrastructural alteration in the retina even before its clinical appearance. These biomarkers like disorganization of the inner retinal layers, that is DRIL, ellipsoid zone EZ, and external limiting membrane disruption, presence of hyperreflective foci in different retinal layers, taut posterior hyaloid, that is responsible for recalcitrant macular edema. Objective is to evaluate whether qualitative and quantitative changes in retinal layer may affect treatment outcome in patients of diabetic retinopathy treated with intravitreal ranibizumab after 4 months of follow-up. We included 32 eyes of 26 patients with NPDR and 0.5 mg of intravitreal ranibizumab given as per treat and extend protocol. OCT images pre-injection, post-injection monthly for 4 months were taken, and retinal parameters were evaluated on horizontal OCT images within 3000 micron diameter from the foveal center. And then we measured CMT, central macular thickness, subretinal fluid, intraretinal cystic space, disorganization, that is DRIL more than 50%, EZ, ELM, whether they are intact, partially disrupted or completely disrupted, and hyperreflective foci more than 15 taken as positive. Coming to the result, 44% patient belong to severe NPDR group, 56% belong to moderate NPDR group. And changes in DME parameters, we can see SRA became nil after 4 months of intravitreal treatment, and rest of the DME parameters also decreased, decrease was significant. REAL also increased after 4 months, HRF decreased after 4 months, and these changes were significant, whereas taut hyaloid and ELM disruption was changed but not much significant, and EZ disruption after 4 months also found significant. And coming to the visual acuity, patients who have SRF and HRF at the baseline showed corroborated with better visual outcome than the patient who do not have these parameters, whereas ICS, DRIL, EZ and ELM disruption present at the baseline, then patient corroborated with poor visual outcome than patient who have the biomarkers. Coming to other studies like Nagai and et al. Found that high area ratio and large number of ICS at the baseline, these predicted worse visual outcome at 12 months. Like my DME parameters, Kadzirali et al. Also found that significant improvement in retinal thickness as a whole and in individual retinal layers after anti-VEGF treatment in DME. And also in HRF, like my study, Huang CH et al. Found that patient with higher number of HRF in the outer retina had enhanced visual improvement at the 1 year of follow-up after anti-VEGF treatment. So we can conclude that OCT biomarkers of the inner and outer retinal layers are the predictive markers for visual outcome and useful in objective monitoring of the treatment of diabetic retinopathy. Limitation of my study is small sample size and limited duration. These are my references. Thank you.
Questions can ask. Good presentation, ma'am. In cases of non-responsive, have you tried for steroid injections?
No, I have not.
Not concerned with this study?
No.
Okay.
And how many injections did you, was this at the end of the first injection?
No, I have given as per treat and extend protocol. So some patient required 4 injections, some patient required 2 or 3 like this.
And what was your cutoff at when you assess these? How many months from initiating treatment? Or
4 months.
4 months.
4 months.
So some people might have had more injections.
More
and
injections,
less.
some less.
And there was no supplemental treatment of any other kind given, like laser or anything?
No, I have only taken moderate and severe NPDR, so I have not given laser.
But for the macular edema, no for
No,
the
I
grid
have
or
only
focal.
taken consideration intravitreal ranibizumab, and those patients require laser we have done out afterwards, but we have not,
Not
taken
included
in this
in them.
included.
So, but treat and extend was right from the start of the.
Yes.
Fine.
And the vision was checked on
Every visit, and we
no, using the ETDRS chart or the
no,
Snellen?
Snellen's chart.